a small undertaking. So this is not a small undertaking for any of our states. It is a huge, heavy lift. So a state very much has to be committed to engaging in equity, particularly as it relates to language access. I'm going to turn it over to Dr. RaJade Berry-James.
Thank you. Let's see. Thank you so much, Nakeina. I appreciate that. I recognize that we have about 24 minutes left in this session, so I'm going to be straight and to the point. My name is RaJade Berry-James. I have the pleasure of serving as Vice Chair of the Standing Panel on Social Equity and Governance. I also am at North Carolina State University, a professor of public administration, and I also serve as chair of the faculty currently. I had the pleasure to work with this dynamic team as an equity consultant on this very important work to provide recommendations for language access sustainability. One of the things that we did at the state level and also at the local level is really to offer guidance, a gubernatorial guidance in the form of an executive order. So we were looking to recognize that change doesn't happen quickly, although the people in the Commonwealth of Virginia needed specific change to occur in order to improve the type of services and programs that really provided access and opportunity for them. And so we proposed an executive order by way of an executive function to acknowledge that there was unmet need in the Commonwealth of Virginia, and really to help direct administrative agencies to engage in a course of action that would really advance equity and provide services to address language access. One of the things that I want to point out by way of a mandate, which is often what an executive order is it's really a mandate to get right to it, provide the types of services that are needed, and also sketching out an implementation plan on how to get it done. So as we mentioned, and many of my co-presenters did mention, that our real focus was to ensure accessibility and usability of public services and resources. Our primary target with respect to that was people who identified as limited English proficient individuals, as well as people who live with disabilities. And what we really wanted to do was provide support for community integration, inclusion, employment, and independence for these populations that were of concern. So following our study in the November 21st period, we were looking to really conduct research to assess how the needs of limited English proficient persons and people with disability, as well as vulnerable groups living in the Commonwealth of Virginia. You might think about people who speak a language other than English, or people who read, write, or speak differently, but there are other people who are considered vulnerable in this space. These are people who may not read, write, or speak English at a certain level and need help really assessing government services and participate in government programs. And so, as you know from this presentation, there are about 500,000 people in Virginia who speak a different language other than English, who speak English less than very well. And so using the census data, we identified the top 10 languages spoken. And I think one of my colleagues mentioned what those languages are. But we also know that there were 12% of Virginians in the population who are persons who are disabled. And also we have about 11% in the Commonwealth of Virginia who are considered to be low literate or experience low literacy. And so you can imagine this kind of policy approach is really important, particularly as we think about the actions, the policies, and the practices to meet the objectives of an executive order. One of the things I would identify is that there are some state standards, some guidelines, some contractual requirements that really can help support or provide a support system for people who really value and need these services. And so a language access coordinator might help us really identify the kind of language access services that are needed, particularly in the local level or the local communities. Also, they can help with monitoring access agency compliance with some of the executive order specification, particularly around collecting data that helps us really to identify what language access services are needed, whether or not translated materials are available, whether or not signage is properly posted in local agencies, whether or not the measures that we collect make a difference. And so I just say that as part of the needs assessment, reading, speaking, writing, or understanding English using culturally appropriate methods like I speak cards, for example, or signage that is posted, or employees who are bilingual and can help with sort of accessing services. Those are all really important strategies as we think about the kinds of needs that present for people who are living in the Commonwealth of Virginia. I know I'm a little bit long on the time, but I do want to talk a little bit about sort of the responsibility for getting the work done. And I guess in my notes here, maybe I had a note just to mention that we recommended an advisory council who would make written recommendations following a semi-annual or supplemental report. Those recommendations would be made at the executive level of government. And so that would be in the governor's office. We also made some recommendations that talked about the way in which you ensure meaningful access for multilingual communities, for new Americans, for people who are limited English proficient, for people who are living with disabilities and other vulnerable people. And so just thinking about what the state standards are, the guidelines, the contractual requirements, the administrative directives, those are all really important, particularly as we roll out this sort of policy change. And then the other piece is, I mentioned earlier, the language access coordinator. And so really having someone at an agency level who's responsible for making sure that the agency understands the language access services that are needed, making sure that the agency monitors compliance with an executive order, making sure that the agency collects annual data so that they can understand the types of services that need to be provided or the types of materials that need to be translated, or other relevant practices that really help us narrow the gap. Those are all strategies that really feed into needs assessment. Really, I think one of the first things that we did as a group is look at some of our census data to really help us understand which languages are spoken, to help us really understand which state and local services are needed, to help us really understand where people live, particularly as they cluster around the need for these types of services. And so I guess I can keep going on and on, but the one thing that I want to underscore in this section is really making sure that we have developed or enhanced existing websites and hotline services so that the common points of service that often occur either over the web or over the phone or at the information desk or through the mail or even in person, that they all meet the basic needs for people who are living in the Commonwealth of Virginia. And I think that, you know, some of the really important aspects for future hires are really just training and education regarding the way in which we are providing services for people who need the services that government does provide. So I'm going to, in the interest of time, just stop there and turn this conversation back over to Sombo, if you will.
Great. Yeah, thank you so much.
Thank you.
This is really, really important. Access to language is very, very important. If you don't have the need for it, it seems like everything is okay.
Yes.
But if you have the need to have access, it can make a whole lot of a difference. It can actually make a difference between staying alive and not making it. That's how important language is. I remember a few years ago, many years ago, I think more than 10 years ago now, I traveled to Mozambique. and they speak Portuguese there. And I got sick, and I didn't know how to just explain to somebody that I was sick, you know. And they had to call one of the interpreters to come. And this person had gone off, they were away, you know. So, and I kept thinking, and I was panicking, you know, you're in a different country and you're trying to explain, and people are just looking at you, and they have to bring somebody to come and do the interpretation so that you can be heard and you can have access to services. That day I learned a lesson. And the lesson was that language is currency. And those that have currency can spend it. Those that don't have, they can't spend, you know. So it's very, very important that this work has been done and is being done by the Research Institute to ensure that there is access and equity and just leadership, you know, in ensuring that people have access and they can get the services that they need from the government. So are there any questions? I mean, I have my own question that I would like to ask, but before I do that, I want to give an opportunity to the people that are in here. Are there any questions that you would like to ask so that the panelists can share with us? And maybe also the panelists, is there anything else that you'd like to have a conversation around, something that intrigued you as you did this study? Because I'm looking at the people that did this study and I'm thinking, okay, oh, okay, all right. Looks like we have to leave very soon than I thought. Yeah, yes, Dr. Berry James.
I was just going to add that I think what's really important, particularly as we think about how we implement language access and evaluate it, is really to identify the community stakeholders. Really bringing in our cultural brokers and our cultural agents are really important, as evidenced by the experience that you shared.
Yes. So my question was, how do you tie this work with the federal level, you know, documents, for example? So every time I have to complete forms here in the US, I always remember that I'm an alien. And that's language, you know. And just at that point, I feel like, you know, either included, excluded, you know, I feel welcome or I feel repelled. So how do you tie the work that you're doing at state level with what is prevailing at the federal level?
Yeah, I'll just go right in, jump right in and say that one of the responsibilities that we have as public administrators is to broaden participation so that people aren't alien, right? We need to use data-driven approaches to ensure that the services that we provide are culturally competent and effective services, particularly services that others need.
So the call for language, and I know the Vice President has really been so strong on this, you know, asking that the US immigration takes off the word, you know, alien, because it's alienating in itself. I think that's well justified. Are there any other comments, any questions, any insights that you had? Stephanie, Dr. Reid, Chelsie, Dr. Douglas Glenn, we have a few seconds before we leave. Anything that stood
panel. Fabulous. It was awesome.
Was this Dr. Harris? Was this the same Dr.